Hi, today we have with us Dr. Anoop Shaji. He did his BDS from Kerala University of Health Sciences. For a short duration during his BDS, he also worked as a research intern in IIT Madras. He's currently doing his master's in biomedical engineering from IIT Bombay. He's been a speaker across various national platforms. He's also been a speaker for TEDx. Other than this, he's a co-founder of a startup known as Relive. Their aim is to improve the lives of the elderly people. He's going to talk about his journey of shifting from PDS to IIT engineering. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Anoop. It's amazing that you've taken time from your IIT schedule to come and join us here today. We've heard a lot of things about people who make jumps from dentistry to other parallel careers, but from medical field to an engineering field is one of the rarity. So my first question to you is, how did you even get into dentistry? Why did you think that being a dentist is an option?
So firstly, thank you for having me in this platform. I would really want to thank my dad for getting me to dentistry. Firstly, it was not my primary, even my intention to become a doctor. My dad really wanted to be a doctor in his younger days, so he couldn't be, so he wanted his children to be. So that's how I ended up. So I gave my NEET and JEE exams after my 12th. I cleared both the exams, so I had an option to choose either engineering or medicine. So, firstly, to be very honest, I took engineering.
Oh,
I
wow.
had no clue after my 12th. Just like everybody else after 12th, even I was clueless. I didn't know what to do. I had ideas like I knew I wanted to be a scientist. I want to do this. I want to do that. But I didn't know what career was exactly the right for me. So after my 12th, I took a admission in engineering college in Kerala, called as Government College of Engineering, Kozhikode, in a branch called as Electronics and Communication Engineering. I was interested in electronics and computer programming and stuff at that time. So that's why I chose this branch. At that time, by luck, by unfortunate incidents, I also got a seat in NIT Calicut in biotechnology branch. So also the medical allotment was also happening at that time. So there were multiple options in my hand. So the best that my dad thought for me was dentistry. So it was not my personal choice, but my dad who thought that this would be the best for me. At that time, I was very naive. I didn't know what was the right for me. So I just blindly followed his decision. Of course, he'll be wise and he has his experience. And so that's why I followed his notion and I took up dentistry. First year, I was very sure that I liked clinical side of the profession. I also thought that there was something more to me. So in second year, I got this exposure to reading research papers during this path class. So my professor, Dr. Srikar, so the sir, he was very interested in teaching research papers during his classes and all. So that's
That's
how I
great.
got the habit of reading research papers. So I was very interested in research papers. I was reading 2, 3 research papers per day, and I was giving him somebody said, "We can do this. There's a lot of innovation happening here. Why don't we do this?" In my college, it was not a first at college, so we didn't have the resources and the expertise to take ahead all these ideas. So at that time I got exposed to something called as research internship from some of my fellow students. So I got to know about institutes like IITs, ISERs. They take students via something called as research internship program, where you go to this institute for 2 to 3 months, you work under a professor, you work in the lab, and then you make some significant process, you make reports or you publish papers, and then you come back. This counts as work experience for research students. So this was something that I got exposed during my second year. So my second year, I went to an institute called as Bangalore Institute of Oncology. It's in Mangalore, Karnataka. I did an observership basically to
So
understand how
was this
people.
between your college hours? How did you manage to get leave from your college?
Uh, yes, sir. So one good thing about my university was that we always got at least 1 to 2 months gap after each university exam. So
Okay.
we had a gap after second year of around for 1 month. So Mangalore was near to where I studied. I studied in a college in Kasaragod. So it was easy for me to travel as well. So I took up the opportunity. I went there for 1 month. I interned, observed under a professor. I understood how research works. I understood how you take up clinical data. Then how do you record it? How do you do stats analysis and stuff? Then during my third year was actually when I seriously went into doing conference presentations, posters. I also applied to a few IITs at that time. So I think around 2017, when I was in third year, it was the time when things actually took shape. I got All India first in AIPC competition, which is a prestigious competition by IDA. So all these things actually gave me the confidence to believe in myself, to understand, okay, maybe I might be good in it, and I just need to, pursue it seriously. So during my third year, I went to IIT Kharagpur under a professor named Suman Chakravarti sir. He works in microfluidics. So this was something that I really, really, I really
How
like
do you
this
apply
field
for
at
these
that time.
positions? How did you apply for these positions?
Okay. So there are two methods. Either we can cold email the professor, means we don't know the professor and we email them with our resume and our background and our research interests. Second is applying through the research portal, internship portal of the institute. So during May to July, there is this summer research internship programs by different IITs and ISOs. You can apply during the Feb or March time, and then they screen the applications, they call for interview, and then they select, and they'll give fellowship stipend money around 10,000, 15,000 also. So these are the two methods. So I was not
So you
aware
were
of this
lucky
fellowship.
that it was at the same time when you had your vacation also.
Yes, sir. That's one good thing about our university, that a lot of things aligned. Maybe I could say it's fate, or maybe I could say it's luck, but somehow things aligned, and I got the opportunity to venture into research and understand how things work. At this time was when I really understood this truth that I wasn't even not able to believe in the first thing, that even doctors could do engineering. So at that time, I was approached by a professor who said that she was interested to take me as a student for master's program. So she was one of the professors in IIT Bombay. So she told me the whole process detailed. She made like around 3 to 4 paragraphs essay by mail. She told me, this is how you apply, this is how the procedure is. You need to just apply using your NEET score and all. So the whole application process is like, you apply after your internship with your NEET or AIM score, then they'll call you for
So
an
NEET
entrance
AIM
exam or
score
interview.
is basically your which you give after 12th or again after BDS you had to give NEET. How
So
does
the
it work?
NEET PG scores, the
Okay,
NEET
NEET
PG
PG
scores.
scores.
So yes, sir. So one of the main criteria is that we have to complete internship by April, or we have completed the internship and then we have given the NEET exam. But giving
Okay.
NEET exam is very important, that we should have the NEET score by Feb of the year, because the admission season is usually starting from March. The interviews happen usually around April or May. So it's advisable that we finish our NEET exam by Feb, have the scores, then apply. So there are multiple IITs who take scores. They have their own different criteria. Some IITs are like, we want only entrance takes. We don't want interview. Some people are like, yeah, we want both. Some people like, we just want interview. Or some people might even shortlist based on your preference. For example, if I worked under one professor, if he's interested to take me in, so he might give me a project, a fellowship, and then he'll ask me to join as a PhD student. So there are multiple entry criteria in IITs. So the entry criteria that I've taken is that I was asked to give my NEET score after my internship exam was done. Then I gave the admission process, the normal application. Then they called me for an entrance test interview. Entrance test had questions basically from 11th and 12th NCERT textbooks, like physics, chemistry, biology, mathematics,
So you have
and
to revise
English.
your 12th NEET as well.
Yes, sir. That's
Okay.
the thing. They basically test our foundation and fundamental understanding in science. They don't want us to remember all the formulas, but they want us to understand what do these formulas represent, what will happen if there are some parameter changes in it. So what they're basically trying to understand our practical application of science in daily life. So that's something that they test in. So if they understand that the student is good, they give us the offer. So usually there is an offer criteria for at least 1 to 2 doctors per batch in
Wow,
each
that's a
IIT
good
for
number.
biomedical engineering. Yes, sir. So, but it's very difficult because it's one in all India level. So there'll be a lot of doctors who will be applying. So only one doctor gets the lot. So it's a little competitive. But I feel if you are preparing well ahead, like if you start your preparation in your internship time along with your NEET preparation, you can revise your science subjects and understanding, and then go through how do you present yourself, how what are your research interests. I think that is also very important to understand what do you want to do in that degree. Like they'll basically ask, what do you want to do with this degree? What is the scope that you look for? What kind of jobs are you looking for? Or what kind of research profile are you looking for? Or if you're interested in PhD, what do you do in your, what do you want to do in your PhD? What is your research interest and stuff? So I mean, you can't bluff through all these things. So they'll
Understood.
clearly understand what kind of personality is. I mean, these professors are very senior professors, like 30, 40 years experience. So just by listening to you, they'll understand what kind of a person you are and stuff like that. So it's very important that once we are clear of ourselves, like what we want to do, I think it'll be easier for us to do. And and also it's very important that we make a decision of choosing MDS or choosing this profession. Like it's like a big choice. Like if you're having a rank somewhere inside 1000, it'll be very complicated, this choice to make. Should I go for a MDS, or should I go for this program? But if you're really sure about what kind of career path do you want to take, it'll be easier for you. So I think once you start your internship, if you can have that clarity, I think that will be good.
Understood. And the best thing what you did was during your second, third year, only you tested the waters. You went for certain research
Yes.
or part. You did internships at that point of time. So you come to know exactly whether you don't like it or you enjoy it. So that thing what you did, I think was a game changer, and I think people should follow that. Take opportunities when it is available and see what you like. That's a very good thing you did.
Thank you, sir. Thank you so much. I think you have perfectly explained it. It kind of gave me an understanding about what I liked and what I did not like. It kind of gave me an understanding about what my aptitude is and what I'm not good at. I think that is also very important, like to understand what you're not good at. So if you spend more time trying to figure out what you're not good at, and then you're putting more time and resources in it, I think there are high chances that you might not succeed. So once you know what you're good at, you just have to give a little more effort, and hopefully things will work out.
Got it. So other than IIT, are there other engineering colleges where students can apply after this, after BDS?
Uh,
Are you enjoying this video? Then please do not forget to hit the like button below because we put a lot of effort for coming up with videos and such. And if you're worried about what to do after BDS, then this is a channel you should subscribe because we come up with a lot of options you can try after BDS.
So sadly, I think the Indian curriculum in biomedical engineering is still very vague. Most of the institutes take scores based on GATE. So there's an exam called
Okay.
as GATE, Graduate Aptitude Test in Engineering. So there are two papers that BDS is eligible: BDS, MBBS, Ayurveda, Veterinary, etc. It's called as GATE Excel and GATE BT. GATE Excel is for students from life science background. GATE PT is students from biotechnology background. So luckily, these two for these two papers we are eligible. So if
Okay.
you're interested to apply for GATE exam, this will be easier. Like most of the institutes take GATE course. So if you're applying for biomedical engineering, so say NIT Rourkela, which is in Odisha, they have a biomedical engineering program and for MTech program. So
Okay.
you can apply using the GATE score. So that's why I wanted to stress again that during your internship, if you have a clear understanding, do you want to do GATE or do you want to do NEET? It's very important. Like if you're preparing for NEET, just focus only on NEET, then go through MDS or take the admission through the the way that I've taken. Or if you're applying only for GATE, that means you'll have to sacrifice MDS. So there is no option called MDS if you're applying for GATE. You have to put
Understood.
at least one
Can we
year of
give both
1 year of
exams,
yeah,
GATE and
preparation.
NEET?
No, sir. I gave at my time when I applied. It was in 2020 during the COVID time. At that time, only NEET was given as a criteria for admission for biomedical. But lately, I'm not sure what caused the effect. But after I joined, they have included BDS as well for biomedical engineering in GATE exam.
Okay.
So if you're giving GATE, you can also qualify for biomedical program in literally any institute in the country.
Understood. So how is that shift? How are you feeling shifting from being a medico to an engineer? How do you feel?
I would still not say myself that I'm a doctor or an engineer. I would just say that I'm Anoop, and that's it. Like, if they ask something about myself, I'll try to explain the background, but it's very difficult to convince someone that I am either of them. So, best would be that I was very sure in my undergrad itself that this was something that I really wanted to do. And so I prepared accordingly. So I had prepared mentally as well that there'll be a lot of mathematics, there'll be a lot of coding, there'll be a lot of electronics that I will have to learn. So since I've conditioned myself and I've prepared a little bit preconditionally, I think it was a little okay. But if it is something like, okay, if you're not good at math, it would be very difficult to survive in biomedical. If you're not if you're not interested to learn different things, like new things like coding or how to solder different circuits and stuff, will be very difficult. So once you have preconditioned yourself, once you have know that okay, this is something that I want to do, if you're determined to do it, I think you can crack anything in this world. So that mentality that you want to do it, I think that is most important when you're shifting to a very different field. Personally and from my seniors experience, I can say that anyone can succeed in this field as long as they're passionate about it. There are a lot of doctors who are working now as AI engineers in different reputed startups from my college itself. So I think the sky is not the limit.
Understood.
The If you're really wanting to do it, you can literally do anything in this world.
How is your life in IIT? How's that shift? How does your regular day look like? Because you've seen all three idiots and everything, but I'm sure it's nothing like that. So how is the life in
Oh,
IIT Bombay?
the life in IIT is good. I think I can give a perspective from how it used to be in my dental college to how it is in my master's college. So in dental college, we had a routine. Like we had our clinic starting from 8 to 3. Then after that, we can go back if you want to study or you can revise, or if you want to do some private consultation that you can do. In here, my day starts at around 7. I have to wake up. I'll have to go have breakfast. Then there'll be some lab meetings and stuff so that I have to attend. There might be some journal reading clubs, or there might be some club activities and stuff. So the whole days will be jam packed by lab sessions, academic classes, club activities. I'm also interested in entrepreneurship, so I'll be having meetings with my teammates as well. I'll be also trying to talk to different customers in the sense I'm currently working on a proof of concept of an idea where I'm trying to help senior citizens get a good social well-being and a better social life among the youngsters. So I'll have to talk to different senior citizens. I'll have to try to understand what kind of changes do we have to make, what kind of parameters that we have to make, and what kind of conditions that we have overlooked and stuff. So my day usually goes between extracurriculars, classes, labs, and these entrepreneurship activities. And yeah, the best thing about this college is that they don't stop you for doing anything. Even if they don't have the resources, it's fine. They say they'll still support you. Like if you want to apply for somewhere, they'll give recommendation letters, they'll give the travel allowance and accommodation. So in the sense that there is no from the institute side, it's always a yes. As long as you're interested in, you can always pursue it. And I think that's good. Like they really want us to have a balanced academic and a social life, and that's something that I really appreciate this institute for. In
Understood.
my college, like doctors are not trained. I think what I've really understood from our college is that doctors are very professional. Like we have a very professional life. So we are taught in a way, we are dressed in a way, we treat people in a way, we talk to people in a way. But here people are very carefree. They don't care about rules. They just live life in their own terms. And I think both the sides, there are merits and demerits. I've learned discipline from my earlier professional life, and that's something I feel that have helped me also. And it's okay even if people are a little carefree also, because everybody works in different ways. So there are a lot of good things that I've take from my undergrad life, and I'm trying my best to carry those good things forward in my postgrad life as well. But it's I've also understood that MDS is very hectic. That's what my colleagues and my friends say. But I wouldn't say the same for masters, because I'm getting time to explore myself and to, follow my passion and to do different things and to enjoy as well. So, I mean, if you're not looking for a hectic life, and if you really want to pursue something that you're really passionate about, and if you're interested in innovation and entrepreneurship, I think this course would be great for you.
Understood. But these are the rosy parts of it. What do you think are the
Yes, sir.
future challenges to these fields?
Uh, of course, artificial intelligence and chat GPT. I hope everybody's reading the news and stuff. So a lot of jobs which could be automated are in risk. So also, most importantly, even when there are challenges, there are good things as well. Even if chat GPT and artificial intelligence come, there will still be needing someone to test it, to give prompts to it. Okay, this is how you should work, and this is what I need and stuff. So there is always some ways to come above or around this problem. Also, most importantly, there are a lot of jobs that are not in the risk of getting lost. Like for example, being a scientist, AI or chat GPT can't become a scientist on their own to conduct different experiments. So along with the computation side, there are also requirements for people who are interested in wet lab experiments. For example, you want to make some different chemicals and stuff. You want to test it if it is working on a human body or something that really requires human resources. So I think if you're interested in pursuing a degree where you get to learn different analytical skills as well as real hand resources, I think this course would be good for you. For example, if you're interested in pharmaceutical industry, you want to become a scientist in a pharmaceutical industry, you get to learn a lot of bioanalytical techniques and tools in this course. So you can also apply for jobs after this, after learning these tools. So there are a lot of scope for this. Like BDS has its own merits and demerits, and there is a limit to how much we can expand with our degree. There is a limit to how much we can grow with our degree. And I feel this degree, the biomedical engineering, will actually give your career a push and open different avenues for your growth and to expand your understanding and broaden your professional life. So that's
Understood.
something
So
that I
basically, you have
see.
more chances to explore a lot of things. Now, I've
Yes, sir.
gone through your entire resume. You are an entrepreneur. You're interested in biomedical field. You've been working in immunology. So, with so many options across your horizon, what do you see yourself doing in the next, say, 5 years, 10 years, or 15 years? What are your future plans and goals as such?
Yes, sir. So I applied for this program with the goal that I will do a PhD next in the line. So right now I'm applying for PhD positions in Europe. So okay, so I'll give a small gist about how PhD positions work in Europe and US. So US, the PhD curriculum is designed for minimum 5 to 6 years. You will have some coursework, then you will have to do your research work for the next 4 to 5 years. That's how things work. It will take at least 5 to 6 years in US. In Europe, it's more like a job kind of a thing. So they have already the PhD topic fixed. You just need to join there. They will recruit you, and then you can just do the work, complete your PhD, and then come back. So that's how things work here. For me, I feel I'm more suited for this job kind of a PhD theme. So I'm currently applying for PhD versions in Europe. After that, I will be looking to do some postdoctoral fellowship, and I will want to come back to India so that I can join an institute here and work for the betterment of our people.
So, you plan to get into the teaching. You want to work in the research as well, but you want to have a foot in teaching so that you are accustomed to whatever new is happening out there.
Yes, sir. My career ambition is to work as a clinician scientist. So since I already have a clinical degree, I need to have a PhD in the next so that I can come back and work in different organizations like ICMR or join back in IIT and work in the same department in my field of interest. So the scope is unlimited. So it totally depends upon what you really want to do. And one thing I've really understood is that India is becoming more interdisciplinary. So India is accepting that even if you have one degree, you can still have different multiple degrees and you can work in totally different field. So one funny thing is that if you have a degree in biomedical, you can work in chemical department, chemical engineering, you can work in material science department, you can work in nanotechnology, you can work in chemistry also, you can also work in biomedical, you can also join different dental colleges, you can head the innovation entrepreneurship divisions as well. So there are a lot of examples from our own field who are doing the same. So I think if you really want something versatile, biomedical engineering could be a great opportunity for you.
Understood. Now, this is about your particular field, okay? And
Yes, sir.
you have seen yourself from second year, third year, analyzing stuff and everything. But there are a lot of confused BDS students out there and a confused graduates who just completed their BDS degree. What would be your word of advice for them?
Uh, Patience and persistence. Like if you really want to do something, at this time I'm remembering Eminem. So he's one of my favorite musicians. So there is one quote that he says that if you really want to do something and if you set your mind to it, you will do it. You will get it done. So we don't have to give any excuses that this degree is not letting me pursue this degree. It's not. India is becoming very open. A lot of opportunities exist, especially for clinicians. See, biomedical engineering engineers are working on clinical healthcare problems. So who else knows better these about these problems than doctors themselves? So this is a great opportunity. This is the right time. A lot of different departments, engineering colleges, and different interdisciplinary research institutes have opened doors for doctors and dentists to come to do research, to make a real impact. So if you really want to make an impact, be patient with yourself. This process is not easy. You'll have to learn a lot of new things. So you have to be persistent. You have to be dedicated and you have to stay committed to your goal. If your goal is to make an impact and make a difference in someone's life, this could be the best degree option for you.
Great. And looking at you, I'm sure a lot of people would be inspired. And I've seen your journey. It has been marvelous. You have already stuck to what you want to do, and you're always out there to explore. And it's amazing you have taken your time from a lot of things you have told me to do throughout the day to come and share your knowledge with us. Thanks a lot, Dr.
Thank
Anup.
you so much, sir. Thank you for the opportunity. Take care.
Thank you. If you're interested in doing biomaterial research abroad, then you can check our video with Dr. Shreya Shah, who is working on dental biomaterials in the US. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.